Our final guest is Dr. William Sherrod, a physician with Novant Health Brunswick Medical Center Emergency Department. Well, welcome to the show today, Dr. Sherrod. We're here at the Novant Health Brunswick Medical Center Emergency Department, of which I believe you're the director. Is that correct?
Yes, I am.
Good. Well, we just left the 911 call center, and we saw the ambulances and stuff. And so what I'd like to do now is for you to walk us through what it looks like when a patient enters through the doors into the emergency department and out of the ambulance.
Sure, I'd be glad to.
Okay.
So when patients arrive, they actually come into the ambulance entrance as opposed to the front of the emergency department.
Right.
The patients are brought in and evaluated by the nurses and placed in an appropriate room. We have several different rooms that they'll go through. If they have a hazmat emergency, then we might stop in a decontamination room so that we can clean up the patient before they go to their room. If they have a disease that might require isolation, we have a room for that. If they're very ill, then we have a major resuscitation or trauma room that we might utilize. We actually have two of those. So depending on their complaint, our capacity at the time, we make a decision about where's the safest place for them to be.
And tell me, when patients arrive via ambulance, does that give them any priority in terms of being seen first, as opposed to somebody who's in the waiting area? How does that process work?
Well, all patients will go directly to a room if we have a room available.
Gotcha.
But we triage everyone that comes into the hospital, whether it's from the front door of the ambulance, because some patients present with more serious complaints in the waiting room than the ambulance entrance. But we like to try and take care of everyone as quickly as possible, but we do prioritize based on the complaint, vital signs, and the severity of their initial evaluation.
Good. That's good to know. Now, I noticed when we drove up, there's a helipad out, right out the door here. Tell me about that. What kind of patients would typically need a helipad?
We use the helicopter when the patient's out-of-facility transport time is important. So if we want to minimize the amount of time that they're away from medical care, the helicopter is the quickest way to go. Sometimes, due to weather or the patient's condition, an ambulance is still the quickest way to move a patient. And so it varies, but we have the helipad there so that we can move patients quickly. We mainly use it for the ST elevation MIs that present to our waiting room, so a heart attack with EKG changes. And it's usually New Hanover. We'll fly down New Hanover Regional Medical Center and transport the patients to Wilmington.
Yeah. I'm curious, what are the most common types of emergencies? What do we typically see here?
Sure. The main complaints that we see are exacerbations of chronic medical problems. Here it's congestive heart failure, heart attacks that don't present with those EKG changes. EMS generally takes them directly to a facility with a cath lab. But it may just be chest pain without an EKG finding. Abdominal pain, headaches, minor trauma that does not meet the trauma criteria that goes to a trauma center, strokes, which is pretty much bread and butter emergency medicine.
Yeah, I understand that. Well, you know, summer's just right around the corner. And with all the beaches and what have you, I know we have a lot of issues surrounding those kinds of things. Let's talk a little bit about drowning and riptides and things like that.
Sure. Riptides, and we do have those here. There are places on our beaches where currents will come in and then they'll pass back out between bars, and it's a very rapid current that's hard to swim against. And so sometimes patients will get taken out in that. They'll become overcome with exhaustion trying to swim against the currents when they should be swimming along the beach to try and get out of the current. And just trying to be calm and saving their energy to try and rescue themselves. But they might become overwhelmed. They might have a submersion injury where they have periods where they don't breathe and might require resuscitation. And we see that, unfortunately, 1 or 2 times a year here. Our main summertime injuries are still your stuff like sunburns and jellyfish stings and stingrays and fish hooks. But we train a lot for the more dangerous things like the drowning.
We talked to Brian Watts at the EMS Center about drownings, and he said that they see a fair number of drownings in a season, and talked about how they find the beach, you know, with the GPS system and what have you, because oftentimes it's a visitor and they're not sure which beach they're at. But when they get here, tell me what happens with a drowning victim. How does that work?
Well, depending on how ill they are. You know,
Right.
they're usually placed in one of the major resuscitation rooms, given supplemental oxygen, and they'll receive a medical screening exam, and then receive whatever kind of, you know, treatment they need. Probably the most important aspect of a drowning care is what happens on the beach or happens at the scene. The arrest patients, when they have a drowning event, usually have an arrest that's related to a lack of oxygen. And the traditional training for CPR has us doing compression-only CPR. And for these folks, they actually need the rescue breaths. You need to get them some oxygen, and you still need to do your compressions to circulate that oxygenated blood. But doing that immediately is very important. There's a lot of people that are concerned about contracting diseases, which is pretty much unheard of. So you should be able to feel confident that just go ahead and do the mouth-to-mouth. It's very unlikely that you would get any infectious disease, but the patients need that, and their survival really is based on that. We had some very good training from an ER physician last year, Justin Simsrott, who's the medical director for an organization called Lifeguards Without Borders. He's kind of a classically trained LA lifeguard who came down and gave us some education about what to do on the scenes to kind of give the patients the best chance of survival. And fortunately, after his training, we've been able to utilize that, and we actually had a successful patient that we treated that survived and was able to go home neurologically intact after a drowning.
That's amazing.
Yeah, it's fantastic. And some of the best news is having him come down and give us that education gave me the opportunity to ask him if he wanted to join us.
You're kidding.
No, he agreed. So in July of 2015, he's going to come here as a full-time emergency room physician. He's going to work for us full-time, but his passion is still drowning education. And he goes all over the world doing drowning education, and so we're very fortunate to be getting him.
Well, especially living in a beach community and having all this water around us, what a great bonus that is for us to have someone like that with that kind of training in our area.
Yes, and when he came, I asked him why he wasn't working at a beach, and asked him if he wanted a job. So I was tickled to death that he's coming.
Well, I can't tell you how excited we were to come here today and finish up our little tour, showing the viewers how our patients will end up here in our emergency department. So I thank you so much for having us. We'd love to come back when the new physician arrives and talk with him about summertime safety.
Oh, yes, and he's a wealth of information. He'll be happy to talk to you.
Great. Well, thanks for having us.
Thank you.